question, and let's see if you can differentiate what each of these is. Okay. Which of the following nerves innervates the muscles of mastication? CNV1, CNV2, CNV3, or glossopharyngeal?
V3.
It is V3. Okay. Let's see. I'm just gonna ask you, I'm not gonna give you a multiple choice on this one, but what is the branch of the maxillary division of the trigeminal nerve? Like what, never mind, that's not a good question. Moving on. These, I only have the answers. I don't have multiple choices for these, so let's see. Okay, what nerve passes through the annular ring? This you know.
Oh, optic.
Yes, ma'am. Okay. Which, okay, Matthew talked about this. And what artery would be occluded if the central artery of the retina loses its flow? I saw your lips moving, Mariah.
I might be wrong, but is it the ophthalmic artery?
Yeah. I'm good at reading lips, girl. I saw you. You're right. You're right. It is ophthalmic. Okay. Which of the following nerves? Okay, I'm not gonna. Again, I don't have multiple choice here for you, but what nerve provides motor innervation to the orbicularis oculi muscle? The cranial nerve 3.
The facial nerve.
Not 3, but yeah, it's the facial nerve. So think about again. So facial is gonna do. The orbicularis oculi is a muscle of facial expression. So facial nerve will only do muscles of facial expression as far as motor to the face. But it also, yeah, it's only going to do motor for that. Let's see. If you have numbness in your forehead and this area over your glabella, what nerve would be providing that sensory innervation? Yeah, here. What provides sensory innervation for this portion of your head? If you don't know this, I encourage you to go back, and this is one of the things on the list of things that I told you to go back and look that you want to make sure you know.
Did you already see the answer?
No.
Oh, it's cranial nerve V1, ophthalmic.
Yes. Okay. So here's kind of the general rule for this. When it comes to the 1, 2, and 3, they all are going to do sensory, right? So they're going to do sensory. V1 is going to do sensory from your eye creases to the crown of your head. Then V2 is going to do from the creases of your eye to the creases of your mouth. Then V3 is going to do all of this. So that's kind of the easy way to remember. So V1 is from here to here. V2 from here, the eye creases to your mouth creases, and V3 is from here to here. That's all going to be sensory. And then your maxillary division is also going to be helping with your a little bit of motor. Everybody on the same page with me? Yes? No? Maybe so? Okay. Let's see. Okay. What are the bones that make up the orbit I think Matthew just talked about this, so I feel like you guys should know this. So,
I said it in my last session too, so I've said it more than once.
I'll let you phone a friend. You guys can all collaborate.
Psychomatic.
Uh-huh. There's another one. Matthew's disappointed in you. He's going to have tears coming out of this one. Okay, the lacrimal bone also makes up the orbit too. It's just a small one. I think that was, you guys mentioned the other ones, yeah? Okay. Which of the following structures? Okay, what structures pass through the foramen rotundum? I know I went over this in a tutoring session. I don't know that you all were here, but I'll give you a hint. It's a nerve. So what nerve passes through the foramen rotundum?
V2.
Yes, it is V2. And the way you remember this is it's the V2 is the maxillary division, right? So max jumps around in a rotundum. That's the way we were taught to remember. We'll go through that. What structure contains preganglionic parasympathetic neuronal cell bodies that innervate the ciliary muscles? I know that was a packed question, so I'll say it again. What structure contains preganglionic parasympathetic neuronal cell bodies that innervate the ciliary muscles?
Is it oculomotor?
Mm-mm.
No. Pre-sympathetic? Pre-para?
No, it's what structure contains preganglionic.
Oh, the optic ganglion? No. What? I'm gonna keep guessing.
Would that be the ciliary ganglion?
It's not the ciliary ganglion. It's, do you guys want me to tell you? Or are you going to keep guessing? I feel like I'm just going to tell you. So it's the Edinger-Westphal nucleus is what has the preganglionic parasympathetic neuronal cell bodies that innervate the ciliary muscles. The Edinger-Westphal nucleus. Let me pull up something real quick that actually talks about them and I feel like is helpful. Have you guys gone over that at all or not really?
We just know that from neuro, but not anatomy. We didn't.
No, I don't remember
You
that
didn't talk
from
about it.
anatomy.
Okay, in that case, I'll read you this little blurb here and hopefully it helps. So your pupillary light reflex, so if you get a light basically stuck on your eye, right? It includes the optic nerve, right? So it's going to basically go to your ocular, or it's going to go through your ganglion cells to your ocular motor nerve, and then from your ocular motor nerve, it's going to go to your Edinger-Westphal nucleus and then to your pupils. So that's kind of just the route to think of where it goes. It goes through your optic nerve, and then I'm kind of oversimplifying this a little bit, but I feel like there's not, like you don't need to know all of the details, but basically just know optic nerve, ocular motor, Edinger-Westphal, and then the sphincter. Okay. Let's see, next question. Okay, this is an easy one. What muscle moves the eye up and out? So you're going to go up and out this way. What muscle does that? More like this, just like.
Did you say up and out?
Mm-hmm.
Oh, that's the inferior oblique?
Yes, ma'am, you are right. It is the inferior oblique. And that's kind of some questions that you can guarantee will be on the exam too. They might even like to give a picture of like someone's eyes in like a certain direction and be like, okay, if you were telling them to go this way and their eyes looking like this, what muscle would they use? In the last few minutes, do you guys want to go over those eye movements and innervations? That was the last of the questions I had. Yeah, okay, we'll go over them real quick. Okay, let's see. Okay, can you guys see my screen? No?
Yeah, we can now.
Yes?
Yeah, we can see it now.
You can? Okay, sweet. All right, so this kind of gives you an idea of if you're telling them to move their eye, which way it would go. I would assume, did he give you a picture that's similar to this in your PowerPoints? Yes,
He
no,
gave us a
maybe?
picture, but especially yesterday, there was a lot of confusion in regards to direction.
Okay, so let's talk about direction real quick. So if you are doing like we were taught how to do like the H test when you tell the patient to like, hey, follow my finger in front of your face. So if you're and then you kind of bring your eyes in. So if you're bringing your eyes in, you're telling them to look in the middle and go cross-eyed right there. That's going to be your medial rectus that they're using. And if you think about that, like think your medial rectus is the muscle. In fact, I have another picture I'll use. We can go over just a couple minutes here. Hold on. Where's my picture of the eyeball? Come on. It's here somewhere. Give me 2 seconds, guys. Amongst all of the many things I have here, I know I have that picture. Because it was right next to the one it just came from. Or not. I can just open. Anyway, you know what the muscles of the eyes look like, but essentially, right in your medial rectus, the one that's going to be more medial, right? If that you think about like where it's attached. If it pulls in, your eyeballs are going to go in towards your nose, right? Whereas you think about the opposite direction now, if we're going to look out to the sides, right? So that's going to be your lateral rectus, because if your lateral rectus is now pulling, think about the attachments, they're going to go this way. It's hard to do that with both of your eyes at once, but just do one. If you're looking like your periphery, if that muscle now contracts, you're going to go look to out. So that's your lateral rectus. That one is if you think about it too, you're abducting your eye, right? You're taking your eye away from middle. That's innervated by the abducens nerve, which is cranial nerve 6. That's right here. So now if we've done those motions, right? We've done in, which is what? If I'm going middle, what nerve does that? If I'm telling a patient to look right here, what nerve does that?
That's oculomotor.
Ocular motor. And what muscle does that?
Medial rectus.
Good. And if I tell them out, it's what?
Lateral rectus, and that will be 6. Abducens, sorry, thank you.
Right, abducens, because you're abducting your eye, right? You're taking it away from midline. Okay, so now what we're going to do is now looking at inferior oblique, right? So inferior oblique is now if you're going up and slightly out, right? So this direction versus if you're doing superior rectus, you're going to go up and out this way. And then opposite would be superior oblique is going to go down. And this one is called, I wish I could find that picture that I had for you guys because you can see the trochlear.
So while you're
Here it
looking at
is.
that picture, um,
The trochlear.
there's a mnemonic. It's LR6 SO4 and 3. It's like a chemistry symbol type thing. Gonna type it in the chat so it makes more sense. But that's how I remembered the cranial nerves and how I innervated the eye. It helped me a lot.
I think I may have heard that, but I don't think I ever put it
Wait.
into practice.
It's LR6. Hold on. Ignore that first one.
So I feel like this picture is actually maybe even a little bit more helpful because it kind of shows you where it's going. But when it comes to this superior oblique muscle, so it's coming at an oblique angle, right? So this muscle here, it has a little like slingshot kind of holder called the trochlea. So that's how I remember that this muscle is innervated by the trochlear nerve. So this is going to be your cranial nerve 4 rather than your cranial nerve 3 or 6. So there's 3 muscles that innervate the eye. What are they? Or not muscles, 3 nerves that innervate the eye. What are the 3 nerves that innervate the extrinsic muscles of the eye?
The oculomotor, the abducens, and trochlear.
Good, good. So basically the name of the game is just know what nerves innervate what, because that's definitely going to be a question. So the way to remember, again, like I said, for lateral rectus, just remember that abducts your eye, so that's abducens, and then your trochlear nerve, or your trochlea, is that little slingshot that holds your superior oblique, so that's what's going to innervate your the trochlear nerve innervates your superior oblique, and everything else is innervated by your ocular motor nerve. And like Matthew said, the only one that's not going to be involved in that annular ring is going to be your inferior oblique, because your inferior oblique is over here. It's attaching, like if we had the full picture of the eye, it's attaching over here. It's not going to be attaching back to that common tendon, basically. We feeling okay about the eye? Was that
Where
helpful?
does the
Did I confuse
inferior
you
oblique
more?
attach?
It's kind of hard to see. Here, I'm going to stop sharing with you and see if I can pull up another picture that you can see better. In the meantime, give me 2 seconds, Berkeley. Okay. So it attaches to the maxillary bone. I'm trying to see if there's... Okay, this is an okay picture. You can kind of see it from a side view. Oops. Just open image in a new tab. Okay, where'd you guys go? All right. Start sharing screen. Okay, can you guys see my screen okay? Yeah, okay. So see here, here's your inferior oblique, and there's your maxilla, and it's attaching right here. So it's on the maxilla. Does that answer your question,
Thank
Berkeley?
you. Yeah.
Yep. Whereas you see how all of these other ones, they come right there into the annulus of Zinn or annulus, common tendon, whatever you want to call it. The inferior oblique is the odd one out in this case. Okay. Alrighty, guys. So hopefully that helps a little bit with the eye. But if you guys ever need any additional help or whatever, feel free to reach out. All right, we'll see you guys later.
See you guys. I can't hear you, Tanya. You're muted.
I'm always muted. Let's be real. All right. Well, hopefully that was helpful. Sorry, I didn't mean to like totally take over either.
No, you're good. You're good.
I'm
Like
not very
always.
good on the eye. The only thing I like really knew was the eye muscles. That's like the only thing I'm good at. So
Aaron was sitting here. He's like, "Ooh, I'm learning now."
not all the like I know like sensory and all that stuff, but I don't know like where the ganglias go or anything like that. So like there's no way I was helping.
Honestly,